Traditionally, lung cancer is detected quite late. It's often too late for a lot of people, and obviously, as we all know, with any kind of cancer, the earlier we can detect it, the better, and give the best possible access to treatments. It's looking into early detection of lung cancer. So it's looking at some tumour markers in the blood to see if they are an indication of early lung cancer, and also looking at some cells at the back of the nose by way of a nasal brushing. By having a look at these cells under a microscope, they can see whether there's the potential of those to be cancerous and therefore predict lung cancer a lot earlier.
At the minute, the screening for early stage lung cancer it includes a low dose CT scan, which is useful, but doesn't pick up all early stage lung cancer. So what we're hoping is by including blood and nasal scraping tests in the screening, that we can improve the rates of detection.
So we collect the patients from the CT scanner. The participants, walk them down to our room, take 4 blood samples and a nasal brushing, and then they get sent off and looked at in the lab. 1, 2, 3.
It's a good thing overall. As long as it, like I say, as long as it's helping someone else. All straightforward, no problem with it. So anyone else is welcome to come along. Don't be frightened. I mean, 72 now. It's, you know, if there's anything in my body that can help someone else, fair play.
So the vast majority of cancer clinical trials are done in hospitals, and they're offered to patients who've already been diagnosed with a cancer and are undergoing either chemotherapy or radiotherapy or surgery. Here's one where we're offering participants the opportunity to take part at a much earlier stage, before anybody's having any treatment for lung cancer, with the aim of we can pick up the lung cancers at an early enough stage, then these can be treated in a much less invasive way, without the need for long-term chemotherapy.
It's just really nice to feel like you're making a difference. And the patients feel like that as well.
I think it's a real buzz to really, be involved with any kind of research, and especially something like early detection of lung cancer, because you're not just helping an individual at that moment. You'd be helping people in the future for generations to come.